and I am committed to improve the conditions in nursing homes and hospitals for patients and staff. Most of you know and are here because the We Care Committee is part of our ongoing informational series that has been a great success, bringing together hospital and nursing home workers from all departments, elected officials, community leaders, and advocates who all share the same very important goal. We're committed to ensuring quality care in our healthcare facilities, nursing homes, and hospitals. We are dedicated to improve the lives of working Floridians and their families. We demand good jobs, fair pay, and a voice in our workplace to make sure caregivers and our patients are properly protected. We work to elect leaders who will truly serve us with good laws and policies. And we will never stop fighting to make Florida a better place for all. So tonight, we will be highlighting 3 important topics that impact our members, caregivers, and communities across Florida. First, we'll hear from organizer Norvelyn Pichardo, I hope I said that right, Norvelyn, and member Chiquita Brunson about a big bargaining win in 1199 SEIU members at UHealth Tower in Miami. Then we will get an update on the bankruptcy case and upcoming events related to Steward Healthcare, organizer Mark Cresswell and Wanda Jenkins, and purchasing clerk at North Shore Medical Center will cover those topics. Finally, we will summarize the launch of the statewide long-term care bargaining campaign, including the latest negotiations with Aspire Health. Aspire operates 11 facilities in Florida, which 1199 has members. I will hit these LTC campaign highlights with the help of Margaret, our great VP of LTC. I would like at this time to turn it over to Norvelyn and Chiquita.
Good afternoon, everyone. I'm Chiquita. We also have Norvelyn.
I'm sorry.
I'm sorry, Chiquita. I misstated your name.
No, it's fine.
Okay.
Go right ahead.
Good afternoon, everyone. My name is Norvelyn Pichardo. I am the union organizer for UHealth Tower employees, and I've been a union member of 1199 for the past 27 years. It's an honor to be here and to give you information on our wonderful victory at UHealth Tower. Next slide, please. We do have a labor management partnership with UHealth Tower, and what you can see in front of you is lots of information on different levels of relationships that us as a union that we can have with management. What we like to do always is to have a cooperative and a collaborative relationship with management, but we always do remind them that we will not hesitate to go towards the red portion, where we make sure and we let them know that we'll do pickets, strikes, and take action if needed, which we were very close to during this campaign. And Shaquita will tell you a little bit more on how we started towards how we ended. Next slide, please.
Okay, so basically on this slide right here, it shows the interest-based bargaining, which is for short is IBB. It's a framework that allows us to have informative dialogue at the bargaining table. We collect and share stories. We We spoke freely about the issues and management shared more information with us. They were also open to new ideas. This basically means that we show them that we're there to be a part of anything that management need helps with, but it also shows them that they're able to open up a little bit more to give in. They're able to open up a little more to give insight on a lot of the different topics. And like on the yellow side, it shows the define the issues, identify and discuss interests, develop options, propose relevant solutions, use statistic stories and suggestions to brainstorm solutions that match experience or perceptions with facts. So coming into this contract, we cover over 2,600 employees. About 1,200 of those employees are kind of new employees at the hospital. So we came to management to try to help them to understand it's important to keep the employees there. So we strategized to find ways to keep the employees there at the hospital long term, not short term. So this is where it comes into interest-based bargaining. The next slide, please. Here's the economics part. On the purple side, it says UHealth proposed package started with $22 million for 2,615 workers over the course of the 3 years, which barely is 3% or 2% raises. But over the 6, we started bargaining early. So we started around December. So we can be prepared by time it's time for us to sit at the table. So over the 6 months, we moved them from the proposal package worth $43 million, which brought it up to for 3 years is a 5%, 4%, and a 3% minimum pay raises. But in some cases, we had even some employees go as far as 41% raises. So in the overview, this shows the base pay, the wage and equity and career tiers, the bonus pay, shift differentials, and other benefits. So when we go to the next slide, Noveline will give you some insights of some of the things that took place. And another thing, they originally started off with a $22 million bucket for the 3 years of our contract. We brought them up to a $43 million bucket for the next 3 years of our contract. The next slide, please.
Thank you, Shaquita. Well, here you can see in detail what we were able to obtain for UHealth Tower employees. When we speak about market adjustments, where Shaquita said that there was employees that received over 43% raise, that is because one, they were below the wage in comparison to their years of experiencing certification, education, and licensing. And that is also taken into account when you're doing a market adjustment in a union contract. Just today, I gave information to one of our union member. She called me wanting to know what would be her raise, and she's a CNA. She has 25 years of being a CNA, and she is the highest one that we have on file for 47.9% increase, which is wonderful. When we did the contract ratification vote and we were showing the union members their numbers, what it would entail and the market adjustment, because we were able to move the CNAs into year 1. From year 3, we moved them to year 1 because we believed that they deserved it and they were well below their market value. We had CNAs crying in the room when they received and saw their numbers, and then led them to vote if they were for the contract. Career tiers, it's an implementation of growth opportunities within different departments. This year, we were able to get EVS, meaning housekeeping, and also patient transport, which they are involved in a lot of customer service, dealing one-to-one with patients. So we're going to be developing different levels for those two departments. Shift differentials, the shift differential, the history of shift differentials at UHealth Tower, they had not been touched in 20 years. So this contract, we were able to get the shift differentials increased starting at 150 up until 850, depending on the job title. Not everybody is 150 through 850. Different job titles have different levels, but there is a growth in terms of, there were job titles that never had shift differentials, and now they do have them. In terms of administrative assistants, they did not have shift differential, and now they have shift differential. And the range again is 150 to 850. The retirement contribution, in the past, there has been, the workers were wanting more match to their contribution. And during this contract, we were able to increase the retirement contribution, depending on how many years of service to UHealth Tower, it can go up to 10%. Next
And
slide.
also before, when you was a new hire at U Tower, you didn't get anything matched until after 5 years. Now, after 1 year, you're matched to your highest contribution that you would like to match to. So even though the hospital matches 10%, you're now able to match that 10% after just 1 year of employment, where it used to be 5 years. So that was a big impact as well.
Yes. Next slide.
Okay, so here's the work environment. This comes with the staffing, the workload, communication, equity, and fair treatment. Okay, so when it comes to staffing, the matrix and the meetings, it used to be 30 days before. Now in our new contract, we have it where it's 14 days of matrix that we're able to see the matrix, and we're able to have a meeting immediately when it comes to staffing, so that we make sure the employees have safe staffing. So if it's the issue, they're able to fill out the form, and we're able to see that immediately. And in 14 days, they have to show the matrix, and we'll have a meeting to deal with those issues when it comes to staffing. The workload, when it's scheduling and on-calling, this was a big issue with a lot of the OR and special procedures department. So now we're able to deal with this and see it hands-on first before getting the information later and having to deal with it later on. When it's communications, now things are 30-day notice, electronic contract developed by UM. So we're trying to get where it's not as many contract workers as well. We're trying to get those who are contract workers onto the hospital, so they're able to be a part of our union bargaining team as well. When it comes to equity and fair treatment, the Just Culture Department meetings, job committee, and pay transparency. As you know, here in Florida, we didn't have anything in our contract at UM for the jobs committee. That was something we took out of the New York contract, and that was something that's very big to have here. We're going to meet 4 times a year with the jobs committee, where we're able to talk about all different type of things, especially pay transparency, because of course we know things are always changing when it comes to pay. Things are always changing when you go to school and finish and get your certification or degree. So we're able to address these things within a year of the contract. So that was also a big thing. Next slide. Worksite actions. These are some of the things that we did to make sure that we show management that we meant business and that we wanted a fair contract. So here are some of the things, and these are the data and the numbers that shows these things. We did electric online. So we did petitions, surveys, purple text, WhatsApp groups, robocall, and social media posts. And in person, we did the purple up days, purple ribbons every day, walk-ins during negotiation. When we say walk-ins during negotiation, we were at the table and we had some of the members who are union members come in, and that really scared management as well, because it was so many of the different departments of employees come in to sit in on the meeting to show management like we all are involved. So we also had weekly member meetings. We had photos and quotes. We picket count on me and mock votes and refuse to extend contract. So as we were getting closer to our contract ending on May 31st, management was getting worried as well. They kept asking, so if we don't reach a resolution here, are you going to extend the contract? Are you going to extend the contract? And in negotiation, DeQuasia kept putting that off. She would go on to something else. She would go on to something else to keep them on their toes. So here you see it shows we kept the data open for management to be able to see the numbers, to show how many people are participating, because we kept telling the employees as well. It's something that DeQuasia uses. If you it's like a gym membership. If you go to the gym, if you work out, you're going to see results. Your union is the same way. If you be a part of a union, you put in the work, you're going to see the results. And these was some of the results of what the members were putting in the work and getting the things done.
I just want to add that our workers at UHealth, our members at UHealth were very engaged during this campaign, this contract campaign. We distribute over 1,500 purple ribbons and lanyards. And there were times where they were just calling, they needed their purple ribbon, they wanted lanyards, if they can use t-shirts, and we weren't able to, give them t-shirts to wear because it wouldn't be part of their uniform, because they have to wear certain specific uniforms. But they were very geared up and ready to fight and take it to the streets. During our weekly membership meetings on Wednesdays, there were times where we would recruit new membership. They would come and fill out applications wanting to join the union. Also, we had workers from other departments that are not part of our bargaining unit coming to our weekly meetings, trying to be organized. We have physical therapists, occupational therapists. We have workers from Baskin Palmer, from Sylvester. During this contract campaign, the word was really getting out. The workers were geared up and they want to be part of 1199.
Correct. And also, just to piggyback on what Novaline said, when it says, when you see on the slide where it says 748 employees, so 748 employees were on the petition to get us going in bargaining, and which departments and group titles cared the most. Then we had to make tough decisions about what to prioritize with the pot of the money and how to push them to get more in the pot. They knew 536 people responded in less than 1 week. Which departments cared the most. So that's how they knew, management knew who was involved. So of course, the nurses are very important. And this time around, the nurses were very involved. So again, it took everyone to put everything in the pot to get what we got this time around. The next slide. And on this slide, it basically shows transformational, not transitional. This was something that we kept telling the workers, this is not transformational, this is transitional. So on this slide, it says, we had a quote that it said, we're in it to win it. We work together to get results. Management sees the activities day in and day shift visits to all the floors. Members signed up for recruitment. meetings or go visit other floors. We had even workers on their off days to come out to help and to walk the floors to get to notify the workers of what was going on different days of our negotiation. So it was very important that the workers were involved. So
On the other side of the slide, you see we were able, throughout all our notification during this contract, we made sure that the sign up QR code and the link for our membership. And as you can see the data, we recruited over 120 new applications throughout the contract campaign, and the 76 new membership, that was during the 2 days of contract voting ratification. We had workers that wanted to see their numbers, wanted to participate and get informed, and in order to see your numbers, you had to be an active member. And so they signed up right on the spot to be able to see their numbers, and all of them were very happy. This was a contract that there were more membership and engagement, which was important. And since I've been at UHealth Tower, it's been the best contract so far. So from here forward, it will only get better.
Exactly. And also on the chart, it shows from November to June, the recruitment of 224 new members and 64 PAC. So at this moment, when we're home, when we're just getting up for work in the morning, we're still getting memberships through online, letting us know that people are still signing up to be members. That's how impactful this contract was. And we always tell them, if you want a voice, having a voice is being a part of your union. And when you're a part of your union, you're able to stand up and you're able to have a voice. So we encourage them all to always sign up to be a member. So that's why, like Noveline said, we made sure that we had the QR code on every flyer, on anything that we talked about, so that they're able to sign up at any time to be a member. And you can go to the last slide, please.
We had about 33 contract action captains and 20 people on the bargaining team. This is what it looked like at the end of the day after bargaining. Some people had to go to class, back to work, or to appointments, but a group of us stayed behind to record robocalls and videos. Can you play the video, please?
Let's do it. Let's do it. Let's finish it. Let's finish it. Say in it. Say in it. To win it. To win it. Say in it. Say in it. Say win it. To win it. Say victory. Victory. Say victory. Victory. Say victory. Victory. Say victory. Victory.
Thank you all, and
thank you guys for hearing us out, and we wish everyone the best contract what they're negotiating, and if you guys need us, we're here. So thank you guys.
Thank you.
Oh, I would say thank you, ladies. That was absolutely amazing, and wow, I'm just in awe. You guys did wonderful. I mean, the way you put that together and your team pulled together and they all work together like that, that's wonderful. Wonderful. Great job, ladies. Great job. Now I'm going to introduce Mark and Wanda to talk about Steward.
Thank you. Thanks, Noveline, for sharing that. I think that's important, especially as we transition to talking about Steward. It's a real testament to how important it is for workers to stick together. And when you are together, these are the outcomes that can happen. Because there are some amazing things in your guys' contract that I wish that we could see in ours. So I hope that the Steward employees that are on the phone understand this a little bit. So I just want to give everyone a brief update on Steward bankruptcy. At their last hearing, they were able to secure the financing that they needed to ensure that they're able to continue to navigate the bankruptcy process, that they would have enough cash flow to continue to run their day-to-day operations while they navigate this process. So they were able to do that, and so we're kind of moving in that direction, but it also has changed the timeline a little bit. We in Florida will be a part of what they're calling the second round of their global bidding process. So any potential buyers or interests in any of the facilities, everything is for sale as by itself or as a unit. The hospitals. So all bids in Florida are due August 12th. And if there's and there will be a sales hearing to approve any potential sale. That will be held on August 22nd. So we really don't know who's bidding on this for a number of reasons. But as those dates approach, it's, the reason why I want to bring this up really is because there's so many rumors at all three hospitals. It's they say that we're being bought by Jackson. I've heard every healthcare provider is buying these hospitals. And the truth of the matter is we don't know. And we are as close as to the truth as we possibly can be because we are a part of these hearings. And so we're as close as we can get to knowing the truth. And the reality is they're not obligated to tell us that until they have to tell us that. And there's laws around it, insider trading and things like that. So it's not really that they're trying to prevent us from knowing the truth. It's just that, there's laws about it. But in the meantime, what we're seeing is quite the opposite of what they tell their employees, what the CEOs of these hospitals have been telling them, that, now that we're in bankruptcy, we're going to be able to start paying vendors and we're going to start getting the things that we need and so forth. But what we're really seeing is repossession of equipment. They repossessed AC units at an outpatient facility at Palmetto. Now, all those patients are moved in-house. Currently at North Shore, they're trying to repossess vehicles that the hospital has. And it's my understanding that employees over there have been directed to hide the vehicles. And so this concept that vendors are going to be getting paid and we're going to start getting the supplies and things, no, they're not receiving that. And as the census continues to drop at all three facilities, we're seeing more workers canceled and having to use their PTO. All these things are bad, but they're doing everything they can to cut corners in terms of financial with workers. They're having, in some situations, having non-bargaining unit employees doing our union job. So this is an ongoing thing that is going on with Steward. But this really affects the community at the end of the day. At the end of the day, all these things that are short supplies, not having staff, which Wanda will talk more about, these definitely not only affect the employees' livelihoods, but it really ultimately affects the care that's provided to the community. Because if we're not taking care of the healthcare workers, and the reality is these companies aren't taking care of them, they're not doing the right thing for workers. And when we don't do that, I ask everyone on this call, if a person is struggling in their own personal life for their own existence, what kind of quality care can you really expect at the bedside? So doing the right thing really does start with the corporation, providing the tools for the employee to feel confident and secure and giving care at the bedside. Because right now that confidence is gone. The community is hesitant to come to our facilities because there's so many rumors out there. And so we need to change that narrative. We're trying to control that narrative. And so, as you can see from what was said about there's power when we show up. And so everyone on this call, whether you work at Palmetto, Florida Medical Center, or North Shore, we are going to have a press conference next Wednesday at Palmetto at 11 o'clock in the morning. It's a 30-minute thing. We would love for everyone to come and show support because we really need to stick together because we don't know the outcome of what's going to happen. And we don't know who's going to buy, and we don't know how they're going to be towards the union, whoever the new owners are. So we want to make sure that when that time comes, that we are all united and we are really strong in our hospitals in terms of membership, because we will immediately have to engage with whoever takes over and start bargaining for a contract. And if we're not strong from the start, it will be an uphill battle for workers. And I just think now is the time. You know, they're in bankruptcy and they file motions to hurt workers, you know, and thankfully the judge so far has ruled in favor of workers. But, you know, now I'm just asking that everyone participate. If there's an event at your facility, like I said, we're doing the press conference next Wednesday, but also in addition to that, we will have a town hall July 15th, I believe, or it might be the 16th. But we're planning on doing a town hall, inviting politicians to come to that event as well. And, you know, we want to fill that room up with community and our workers and talk about how this is really impacting the community and what is the future for these hospitals. So we need to demand some more transparency and clarification from Steward Healthcare. But now I'm just gonna go ahead and turn it over to Wanda to speak upon some of the issues and how what's going on in the facility is affecting care and the community. Wanda, the floor
Good
is yours.
evening, everyone. Okay, my name is Wanda Jenkins from North Shore Medical Center. I'm the supply chain coordinator. And the things that's happening, starting with the OR. The schedulers have to be asked or be told before they could book cases, do we have the supplies? At times we don't have it, we have to borrow from Palmetto, the drill, or other supplies. It is causing significant frustration between the employees up there. The morale is very low. Everybody is so concerned. Some days they have 1 or 2 cases, and some days they don't have any. And then they'll bring them in and they let them work about 2 hours and then they'll go home. Half of them do not have no more PTO. And that is, you know, making some workers go elsewhere to work. And they don't want to go because they love North Shore. Everybody does. And in our lab department, the staffing are being told that they have too many employees, which they are short on phlebotomists. They don't have enough reagents. They have to go to Cleveland Clinic to borrow reagent in order for us to do what they need to do in the lab. And this is because of the credit code that we have. In purchasing what we're receiving, they keep telling us about a performance invoice that you can get your supplies like that. They are not doing that anymore. They want credit cards and, you know, a lot of stuff that we don't have. This is the first time I ever seen the shelves inside of purchasing bare. And, you know, it's getting hard that we have people that be coming in and the first thing they say, they don't want to come here. They're not going to get no care. The community, they are rallying behind us because North Shore has been their safe haven. And right now, they don't feel like they are safe anymore because they are talking to the community less. The community don't know. And that's what I have.
Mark, do you have anything else?
No, I don't. Unless anyone has some questions for me,
Yeah, does
I'll
anybody
answer.
have any questions for Mark or Wanda? I can't see any hands, so if anybody can see them.
I got you. I got you. I'll let you one.
No
So-
questions. That was great.
Okay, Mark, Wanda, that was great. We appreciate you filling us in on what's going on over at North Shore. You guys stay strong, and you're gonna win in the end because you are unionized. You guys are gonna stick together. You're gonna win this. It'll be all good in the end. All right, thank you. So we're gonna move on now. And I'm gonna hit some of the highlights for our statewide LTC campaign. Yes. Does somebody have something to say? Okay. So, and Margaret might jump in, if she needs to fill in some of the holes that I might miss, but, we're gonna start
Hi
off with,
everyone, I'm with Amy. Yeah.
yeah,
Anything Amy missed from the long-term care campaign, I will weigh in. Go
yeah,
ahead, Amy.
that's our great VP
You
of the
got it.
LTC. All right, Margaret. So, a few things I'm gonna highlight for us is like, there's about 50 facilities statewide and their contracts are about to expire. That's a lot, guys. That's a whole lot all at once. Staffing crisis continues, hitting dangerous levels. Turnover is about 60+%. That's huge. That's huge. That goes to kind of show you that people just don't want to stay there. They're tired of working short. They're, tired of not being offered money. We got to take care of our families too. So, these companies that are the for-profit private equity firms, they buy up nursing homes. They exist to make money, not to deliver care. They have the legislator and governor that has let these companies make billions from our tax dollars and on the back of workers just like myself. That is absolutely disgusting. I mean, disgusting. And who ultimately pays that price for that? I mean, our backs, our knees, our feet, everything, but ultimately the residents that are in these nursing homes. That's terrible. Tallahassee has reduced staffing and care requirements that have made staffing and care crisis worse. It certainly hasn't made it better. And I think they refuse to move every time we suggest it. They refuse. So now we have to do it ourselves. I'm just going to give you some examples of what happens in some of these nursing homes when we are working under the staffing levels that have been created for us at the moment. And probably most of you know about what I'm going to say is like some of the residents don't get showers. I've seen them go weeks and weeks and weeks without showers. Some of the residents are being rushed just to eat their meals, especially when you're loaded with agency. When you have a lot of agency and they don't know your residents, there's no continuity and consistency, so they just rush them right through. Sometimes when we have on day shift, they got like 16 to 18 residents. We all know on this call, if you're a CNA, that is absolutely impossible to take care of these residents. Their call lights are on forever. They're waiting for periods of time. Some of them give up waiting, get up to go to the bathroom, fall, break their hips, break their arms, skin tears. We know how that goes. There's a lot of times that in these facilities, and this has been like probably within the last year or so, we're short on linen, short on supplies to do our job. I mean, I've even seen them take out bath blankets and they're cut them to make washcloths so we can clean the patients. And sometimes management will tell you, oh, just go grab them paper towels in the bathroom and, use those. Wow. I wouldn't let nobody do that to me. Never. So those are just a few examples that I got. So we need facility owners to be held accountable, and we need to hold elected officials accountable. In Florida, the majority in Tallahassee hasn't served us. So let's all elect leaders who will serve us. And I mean who will help us make changes. I don't care who they are. I don't care, Democrat, Republican, Independent, it doesn't matter. We have to elect officials that are going to put the workers first, because what helps us helps our residents. We will continue to fight and make these points while we negotiate. We're in the middle of negotiations now with Aspire Healthcare. Yeah. The last
Yeah,
go ahead.
yes, Amy, with Expire facility, we have 11 in negotiation right now.
Oh, I see.
We give them our proposal. They reject 99% of our proposal. We
They
think
did.
we need to fight if we want to win a good contract. And we think by the end of July to August, we have to go on picket line. We have to, if we have to go on strike, we need to do it for us to work in or fight. Like Amy just said, not enough staff to work for us to doing fight and to win safe staffing again. We or to put it even in the contract for management to know 2.0 is not enough, 2.4 is not enough, 2.5 not gonna be enough. That means 2.0 it's worse than what it is. We need to fight like hell. If we need to fight, we need you guys as delegate. We need the community leaders to help us fight. That's not a fight we can win by ourselves.
No.
We need all the nursing home to speak the same language or to fight for the same thing we are fighting. This time, it's about 47 nursing home. We already settled 12 of them, 13 of them, I think. But we think with Expire, with the rest of the nursing home, the majority of them, if we don't fight, we're not gonna win. We will ask you guys for the support. We will ask you guys to support the workers in the action they're going to stand in the picket line, stand and the strike line. Without the community, without their co-workers, without their leaders with them, we're not gonna win this time. Let's fix or let's win a good contract for Aspire, all the Aspire nursing home. Let's win a good contract for the 47 nursing home we in contract bargaining this year. We will set not the language, but we will set a tone for next year, because next year we're gonna have a lot of nursing home who's going in contract negotiation. If we want to win a good contract this year or next year, let's set it up this year. Go ahead.
Thank you,
Amy.
Margaret. Thank you. So, just so everybody know, we are preparing and we are getting all of our nursing home workers prepared because we are ready to picket. We're ready to strike because you know what? They do need to respect us, protect us, pay us, and staff us. It's highly important to us in our contract this year, and we're going to be ready to fight. So so that was good. So are there any questions? We're going to open. I think we got a couple minutes, like maybe 2 questions. Anybody have any questions?
But before the question, Amy, what we're moving right now, the call for action, what we're moving right now, it's every workers. It doesn't matter you aspire or not. We're moving the count on me to tell management or to say yes or no, you're ready to fight. You're ready to win a good contract. When you see your MO come to talk to you, MO, the member organizer, come to your shop, try to talk to you, your co-workers, your leaders come to talk to you and asking you to, can them count on you to fight for a good contract? We want to know where you stand. Are you willing to fight or you not? The question we ask, yes or no. Can we count on you to fight for a good contract? That's what moving on the facility right now. By the end of July, we should be ready. We should know how many nursing homes willing to fight for a good contract. By first and second week of July, if we are willing to fight, we should be either on the picket line or on the strike line.
Absolutely. Thank you, Margaret. So now we're going to take questions. Any questions? Everybody ready to fight? No questions. They're ready, Margaret. That's great. Okay, so I'm just going to read off some of our call to action. So please, everybody support nursing home workers by signing the LTC Count on Me form. We need to get those signed, get every member in the nursing home, like Margaret just said, and get all that done. Watch for more details and join the Steward events noted by Mark and Wanda. Our strength grows with more members. So join 1199 SEIU at the link shown on the screen. It's real easy, takes less than 2 minutes. You're done, you're a member, and you can come out and help us fight. It's a big election year as well. Make sure you stay informed and are registered to vote. Huge thing. Please check to make sure you are registered to vote. Make sure your registration from last year is still good for this year. Check it. It's very important. Coy just put something in the chat. Yes, please check that. It's a big, I already read that. Watch for endorsements from our union and partnership organizations. We put it out. We let you know who 1199 SEIU endorses. And yeah, educate yourself. Go online, search them out. We're picking people this year that are going to work for us. Or we're going to work for our hospitals, work for our nursing homes, that care about the workers, that care about the patients. That's who we have to vote for this year, guys. Mark your calendars for our next WCC committee meeting. It will be July 18th. And hopefully we'll have some great updates as well. Is there any questions at all? I think we are going to end the call early. Margaret, you got anything? Coy?
No, thank you. Great call. Congratulations, UHealth Tower, on your victory.
Absolutely.
We got your back, Steward, long-term care.
Yes. Thank you, Coy.
Yeah, what I tried, the last word I want to say to long-term care leaders who's on the call, UHealth Tower celebrate a huge victory. For us to do that, also, we have to fight like hell. We have to fight a good fight if we want to win a good contract. Let's go for it. Let's talk to our leaders. Let's talk to our members. Let's have a conversation with all of us to know where they are. Can we win a good contract? If we want to win a good contract, what needs to be done for it? Good night, all.
Good night.
Thank you, everyone. Have a good night.
Good night.
Good night. Good night.
Good night.
Good night.
Good night.
Good night.
Good
Good
night.
night, Wanda.